Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Benzodiazepines. These benzodiazepines will also bind to the GABA receptors. But the difference is benzodiazepines will increase the frequency of opening of the GABA channels, whereas barbiturates will increase the duration of opening of GABA channels, whereas benzodiazepines will increase the frequency of opening of GABA channels. So these benzodiazepines are called as GABA facilitators. They are called as GABA facilitators. Then, then we have atypical GABA receptors. We have some of the atypical or non-benzodiazepine drugs. These non-benzodiazepine drugs or atypical benzodiazepine drugs include zolpidem. We have zolpidem, and also S-zopiclone. Zopiclone. So we have three drugs, which is zolpidem, zolpidem, and esozopiclone. So these three drugs are non benzodiazepine or atypical GABA receptors. These will only interact with the GABA A, and this GABA A isoforms only. They will interact with GABA A isoforms only, and this GABA A contains only alpha 1 subunit. So it contains only one alpha 1 subunit. So this will interact with GABA A receptors only. So whenever there is overdose, these benzodiazepines will suppress only the hypnotic or hypoxic drive of respiration. These GABA receptors at higher doses, they inhibit hypoxic drive of respiration, whereas the barbiturates will inhibit both hypoxic and neurogenic drive of respiration also.
thank you and thank you for watching.